Hi there. I want to share with you fascia decompression, what it really means, why we compress, and how we can take the body in the reverse order from what time has done to us. The reality is we are under this constant force of gravity. Gravity is pulling us down toward the earth. We don't really notice it any moment in time because it's continual, it's constant. However, as you get older, you start to see it in symptoms. It might be in how your face looks, how your breasts sag, your pain, your dis-ease in your body. It really is a function of how we've compressed over time and what becomes blocked as a result of that. So I just want to share, if you imagine that you're walking a 120-pound dog and it's walking really nice, it's well-trained walking beside you, there's no pulling or yanking on your body. But let's say this dog isn't trained well and it's yanking you and pulling you. What's happening to your body is you're going to be adapting to that force. And it's going to be the opposite side that's going to be contracting so that you don't land flat on your face. That's an in-the-moment kind of force. But gravity is this continual force constantly manipulating our bodies. And what's happening is that the trillions of cells that we have start getting drawn away from proper alignment. And the further they fall from where they're supposed to be, the more adhesions develop in the body. Adhesions basically is scar tissue, but it's slow moving as opposed to scar tissue being from a surgery or an injury in the moment. This is the body continually adapting, becoming colder. Adhesions are basically made up of collagen, just like scar tissue. So what happens, they block blood and oxygen flow to cells, as well as block the ability for the body to pull away toxins, waste, negative emotion even. So over time, we end up with these bodies that go through aging, compression, and dis-ease. So when I'm standing incorrectly, this is me unconsciously standing. I'm very right side dominant. So over my lifetime, from being a provincial volleyball player and continually twisting and torquing, I created a very imbalanced pelvis. And the fascia will grip and adhere most significantly at the toes, at the feet, at the calves, because they are the furthest away from your engine, your diaphragm. Also, the hands and the forearms play a huge role. Palms forward, this is actually anatomical position. This is how we should be at rest. But most people, they've allowed the arms to internally rotate. We're compressing through this space. So that compression creates areas of adhesion. And again, it becomes colder, lacks blood and oxygen flow. And then we have pain, aging, and dis-ease as a result. Just because this is what's happened to us doesn't mean we have to stay in that scenario. Fascia decompression is all about getting to those adhesions, creating a melting effect through adding pressure over time. We do that with our tools, the block baby. You can also use a rolled up towel. The combination of pressure over time, and we stay in position for a minimum of 3 minutes, combined with the instruction of activating your diaphragm. This creates a heating on the outside of the body as well as the inside of the body, because your diaphragm is like your body's furnace. Part of the instruction of fascia decompression is teaching you how to release the rib cage to allow that diaphragm to be more fully activated. And it's a game changer in your health when you start shifting from that upper chest breath, where the body is really receiving very little oxygen compared to what the diaphragmatic breath can do. We also aren't releasing the toxins, the negative emotion out of the body with a poor exhalation. So the whole education of fascia decompression is really about getting access to this beautiful muscle, the diaphragm, because when it's working for you, the physiology is extremely different compared to when you're an upper chest breather. But not only that, we also want to teach you proper postural foundation, because we don't want you to continue to fall out of alignment and allow your body to get pulled down toward the earth. We want to support the body, and we have foundations in the body to do that. One of the foundations is the root. We should have our feet directly underneath our hips. Yet most people, they splay away or they stand too far apart like this, and that's not supporting everything up the chain. And when you hyperextend your knees, now you're asking your ligaments to support your body weight as opposed to the muscles which are designed to support you. One thing you can do that's really helpful just to get a sense of that is bounce. You know, if you're standing watching a TV show or you're doing something in the kitchen, just take a few moments and bounce, because now you're activating your muscles instead of locking the joints, which is going to take away that joint space and cause you to wear your cartilage. And then down the road, arthritis will end up happening as a result of that. So Posturally, there's so many things that we can do to be aware. How do you sit? Are you sitting in a chair slumped over to one side? One of the things that you want to do is you want to be seated with both feet firmly planted on the ground, knees 90 degrees. Because as soon as you pull your feet under the chair, then again, you're twisting your body. So whether you're standing or you're seated, there's things that you can change right away that will make a big difference. But now I want to just show you how simple it is to actually use the tool and the breath for fascia decompression. So this is the block buddy. This is the block baby. These are the tools that we use in block therapy. Again, you can also use a rolled up towel because the density of the towel is enough to get some of those layers of fascia, those adhesions that are locking the body out of alignment, to melt. It won't be as effective as the tool. However, you can make huge gains by just using the towel alone. But I want to share with you why this is so impactful. So first of all, we talked a lot about standing posture, but even just looking at the rib cage when we're seated, I mean, most of us sit in front of a computer for hours per day. And because we're not really conscious of what we're doing, we end up collapsing. The rib cage literally collapses into the core of the body. And as we get older, we often notice it's harder to maintain that hourglass figure or that six-pack or whatever it is that you had when you were younger with your abdomen, because the rib cage is literally compressing into this core space. The tissue has to go somewhere. It's going to go outward. So you might have a spare tire developing even though you haven't changed anything from your exercise or your diet, because it's not fat, it's displaced fascia. And then again, those adhesions, they lock the body with a force up to 2,000 pounds per square inch. So when we're talking about the diaphragm and the significance of training proper diaphragmatic breathing, what we want to realize is this muscle, it moves up and down in the body. It's a plate of muscle. When we inhale, it moves down. When we exhale, it lifts. So we want symmetry. We want the optimal amount of space for this muscle to function. If I'm sitting compressed, now I'm literally freezing my diaphragm and I'm forced to breathe through the muscles of the upper chest. The problem with that is it is at the base of the lungs where the majority of your oxygen receptor sites reside. So if you're breathing in the shallow chest breath, then you're not pulling the air deeply enough into the lungs to reach all of that alveoli. Alveoli, that's what they're called, the oxygen receptor sites. We want absorption. So in the book, Yoga and the Quest for the True Self, the author, Stephen Cope, mentions we can feed the body up to 6 times the oxygen. That's huge because every cell in the body, first and foremost, needs oxygen to thrive. So understanding how to release this muscle and activate it is of huge benefit to your health long term. So what we want to do is we want to, first of all, train where the breath should come from, because if you've been breathing through the muscles of the upper chest for years, like any muscle, we need to train it and strengthen it. However, do know that your body is born to breathe with the diaphragm. So as soon as you start giving the impulse in how to do that, it doesn't take too long to really train this breath. And we want to be conscious breathers all the time. We always want to be activating this muscle. So the very first thing we do is the belly position, where we place the tool, whether it's a towel or the block, right on the belly button, and then we lie on it. Now, if you're pregnant, we don't want you doing this because, well, of course, you're growing a baby in there. You can do block therapy if you're pregnant, but we always avoid the belly if you're pregnant. However, if you're not, then we can do this practice. Now, if it hurts too much for you to lie on the tool, you can try it on a bed. If that hurts too much, you can then lie on your back and simply put pressure into this area as you focus on breathing properly. And when we inhale, we want the belly to get nice and big. When we exhale, we want the belly to get nice and small. So most people, they've trained themselves to hold the belly in, and then you're not using this area at all, and you're breathing like this through those muscles of the upper chest. So we want to really train you to bring that breath down and to slow it down and focus on the exhalation component. So very simply, and start on a bed first if you're concerned about how this feels. All we want to do is place the block and then very slowly lower your body in position and initially stay up on the elbows. And if this is as far as you can go, that's great. If the floor hurts too much, do the bed. If the bed hurts too much, lie on your back and then use your hands for the pressure. And then we want to spend about 3 minutes here. So we want to focus first on inhaling into the block to get a sense of this muscle, where the breath should come from. But then again, as you start to settle in and the sensations start to shift and change as they typically do over time, pain, pressure, a pulse, these are all normal sensations that can happen. But as you start to sink in, things soften, things change, and then we want to focus on that exhale. We really want to make sure that we're exhaling for a longer count than we're inhaling. This is really going to help us push the old, the past out of the body and create space for life. So again, the combination of me lying in position for, again, a minimum of 3 minutes creates heating on the outside, combining that with the diaphragmatic breath, heating on the inside, and now I very effectively create a change. So after 3 minutes, if I place my hands under my shoulders and slowly exhale up, already I'm going to feel a heightening, a lightness in through this area. So with block therapy for fascia decompression, we work the entire body, head to toe. We're going everywhere because adhesions have riddled the entire body, holding us, locking us in this negative fascia pattern. This is how we start. And if this is something that interests you, we have a sampler program where we teach you using a rolled up towel. And again, you'll get the understanding. We talk to you about the foundations, about the release, and about strengthening that proper breath. And that alone is going to give you so much insight into your own body, how you've been pulled out of alignment, as we all have, from time, from aging, and how you can actually take steps in this very moment to start reversing what time has done. If you like this video, please share in the comments below, and I look forward to sharing more with you.